news. I'm a junior doctor working in London now, but a few years ago I was Medsin's vice president, and I've been wheeled back out to help chairing the session. But it's not about me. As I say, I would like to thank all of our parliamentary candidates for coming to speak to us today. I think this session, as I say, illustrates the fact that what we're talking about today isn't really healthcare and medicine, it's politics. So I urge you all to really get involved and ask the questions that are on your minds and keep them coming. The format is very similar to but slightly less controversial probably than the question time session. We have a mixture of pre-submitted questions, but we also want you to have spontaneous questions from the audience. So shout out, put your hands up, and do get involved. We've got an hour, so within that we're going to try and include a few different topics. So I may try and move the debate on at times. When you're asking your questions, try to be focused, think about what you're saying, and keep it very interesting and concise if you can. The most important thing is that you all take part. Just before we start, I'm going to briefly introduce our three candidates here. If I can get to the right page. We have Councillor Tony Sutton here, who is currently on the local council for the Liberal Democrats and is running in the next election, which is happening. We don't know yet when. I'm not going to give you much of a background because you've all got it in your brochure. I want to get on with the questions. Unfortunately, the Conservative candidate, Rowena Holland, has had to withdraw due to family illness. But she has apparently said she's very keen to engage with the local medicine group, so I would urge you to take her up on that. In her place, I'm very happy to say that we have a candidate from the UK Independence Party, Ken Brown. As you don't have a bio, I'll just briefly introduce him. He's a hotelier, the proprietor of a hotel here, and he stood in 3 previous elections against Margaret Beckett and Ken Clarke, amongst others. He's originally from Galway, but has been in the UK since 1952, and has been a UKIP member since 1998. So hopefully we'll get a bit of a spread of opinions here. And the third one is Miss Lillian Greenwood, who is a seasoned union campaigner and is standing for the Labour Party in what is in Nottingham South. Am I right?
That's right.
So yeah, without further ado, we're going to move on. First question. Do we have Helen Preston? Can we get a microphone to him? Stand up. Okay, I think we will start with Labour on this one.
Thank you. Well, I think this is a very good question, Helen, and one on which I will find myself not entirely in agreement with the policy of my own party. I've worked in Nottingham for the last 17 years working for the trade union Unison, which, as you know, represents not the vast majority, a very large proportion of the people who work in the health service, other than those who are employed as doctors. And I'm very concerned about the way in which the private sector has been used, not least because setting up all the arrangements that you need to have in place in order to commission services and outsource services spends a vast amount of money on people to do all that work, and actually I'd much rather that money was spent on improving patient care. Now, the second part of your question really was around how do we approach the NHS in a situation where we've got severe financial constraints. So I just started the question by saying, of course, the NHS is the proudest, the thing the Labour Party has done, of which most of us are most proud. It is a fantastic thing and the epitome of collectivism to say that everybody should pay according to what they can afford to pay, but everybody can access those services on the basis of what they need. And I think it's really important that we take those forwards, and that's why I am so concerned that we need to protect the NHS and improve the NHS, even in a situation where obviously funding is going to be short. And what I would say is that the very best placed people to talk about how we can deliver services better and more effectively are the people who work in the health service. I quite often go in my job and talk to people. I've talked to staff down at QMC, I've talked to staff in GP surgeries and all the rest of it. And when I talk to them and say, what's going on in this hospital, what's going on in this health centre, they very often tell me what they think could be done to make those services better and where they see waste happening. So I think we need to sit down, we need to look at how we can better deliver services, how we can deliver services more efficiently. I'm not against using other providers if that's the best way to deliver what's going to work for patients, because it's patients who are at the heart of the NHS, and it's patients that we need to deliver for.
Thank you very much. I'm going to ask next what the Liberal Democrats' view of the increasing privatisation, well, certainly perceived to be increasing privatisation within the NHS. But I would also urge you, while you're hearing things, put your hand up, think of things you want to challenge, and we'll come to you as and when. So.
The Liberal Democrats have always been strong supporters of the National Health Service. We have to recognise that we now have a mixture of National Health Service and a lot of private provision as well. What is some of the hiving off that's going on is some of the simpler, easier operations and so on, which effectively mean that the national part of the health service is having to do the more difficult parts and is therefore seen as less productive and having to spend more money on the more expensive bits, which means that the private side of the business is actually getting an unfair advantage. Having said that, we still support the principle of a mixture and people having a choice. If they want to go private, then that's fine. But at the same time, our principal support is for the National Health Service. My view of where we are now is that, if you like, I think, let me make this a bit personal. In the last 2 years, my mother-in-law has been in the Queen's Medical Centre 3 times. And within the Queen's Medical Centre, the clinical service that she has had has been absolutely excellent. She had a urinary infection first, and then she broke a leg, and then broke a leg again. And you cannot fault the treatment that she received within this establishment. It's absolutely first class. Having said that, that was the clinical side of it. I always had concerns about the care of her as a person. And in fact, she is 88 and she's got dementia, and had considerable difficulty in understanding the sort of thing that was going on within the wards and the procedures that were going on within the ward. Unfortunately, we now had to move her into a care home where that sort of thing is being addressed more seriously, if you like, or better. What worries me about the National Health Service is there's a bit of an emphasis on the clinical side and not enough, in my view, emphasis on the whole person's needs. And I think that somehow we need to address that and look at, one of the things I was talking about at the Council earlier this week was the link between social care and social services and what happens in hospitals. Because the two need to work together to have a holistic approach in how we look after healthy and unhealthy and sick people and get the best from them. I'm beginning to ramble a bit. I think the answer to your question, Helen, is I strongly support the National Health Service. That would be my first priority. That would be the Liberal Democrats' first priority. There are situations when it's appropriate and sensible to use private provision. I would be very careful about how we do that. I would also want the National Health Service to move away from a target-driven culture and start talking about a people-driven culture, if that helps.
Thank you very much. I'm just going to now hand over to Ken to hear about the UKIP's opinion towards the health service, and particularly I want to keep focus on this idea, this issue about the role of the private sector within the NHS.
Well, I believe totally, or we believe totally, that you could spend the whole national income on the National Health Service, and it still wouldn't be enough. Our policy is that we will radically reform the working of the NHS with an insurance fund, whilst upholding the free at the point of care principles. We will bring back matrons and have locally run clean hospitals. I can only repeat again that you could spend the whole national income and it still wouldn't be enough. So there has to be some sort of reform. Thank you.